The screen is visible now, doctor.
Yes, ma'am. It's good.
So now I'll mute myself. When we'll start, I'll unmute. Okay.
Okay, ma'am.
Thank you.
Hello, ma'am.
No? Doctor.
Shall we start the session, ma'am?
Yeah, sure.
Good morning, madam. Hello, madam. Good morning. Madam, shall we start, madam?
Yeah, sure, sir. We can start.
A warm welcome to all the delegates and everyone. A very good morning to everyone. Today, so as a part of this national webinar on Paanchjanya 2020, so we have a special and eminent guest speaker, Dr. Ramya Alakal Madam, Vice Principal, Associate Professor and HOD Department of Panchakarma, Ashtangam Ayurveda Vidyapeetham, Wayanur, Kerala. And I first of all welcome our guest speaker on behalf of our beloved principal sir, our management and our staff members and all the delegates. And later, similarly, I welcome even the delegates as the faculty members of other colleges, the PG scholars, the students, and even the practitioners. So I welcome all of them for this particular today's session. Similarly, so today, as Madam, the guest speaker, Dr. Ramya Madam, is going to share the current practice of Nasyam. So the different modalities or the techniques what we can use on the different medications which we can use in the different conditions with respect to Nasya and the mode of action and other things related to that aspect. So Madam will explain all these things today in this particular session. So I request to cover the Madam for before going to the session, start of this session. So I welcome Dr. Srinidhi for giving a brief introduction about this about Madam.
Good morning, ma'am. Good morning to all. Myself, Dr. Srinidhi, first year PG scholar from Department of Panchakarma. It's my pleasure to introduce today's eminent speaker, Dr. Ramya ma'am. Ma'am is presently working as Vice Principal, Associate Professor, and Head Department of Panchakarma, Ashtangam Ayurveda Vidyapeetham, Wayanur, Kerala. Ma'am completed BAMS in the year 2008, MD in the year 2012. Ma'am received awards like Agnivesha Award in 2008, NVK Warrior Endowment in 2006, Vaidya Bhushanam Puraskaram in 2007, etc. Ma'am presented many national and international papers. Some of them are Role of Panchakarma in Lifestyle Disorders, Clinical Application of Basti, etc. Ma'am is regular faculty to Pampa Resolute 2020 webinar series. Ma'am also delivered talks in FM 101.3, Akashvani FM radio and TV programs. Ma'am was co-author to Dr. L. Mahadevan's book on Principles and Practice of Snehana. We are honored to have you, ma'am. Today, ma'am is going to deal with the topic, the current practice of Nasyam, a critical view. Before starting the session, there are instructions for participants. Please mute the audio and video while joining the meeting. If there are any queries, please put them in chat box. If there is any network problem, please wait patiently until the resume of network. Thank you. I request you to proceed the session, ma'am.
I think the screen is seen, no?
Yes, ma'am.
Okay. So, a very good morning to one and all. Chaturmukha Samarambham, Vagbhatacharya Madhyamam, Asmadacharya Paryantam, Vande Guru Paramparam. Before we begin, tributes to the great Acharyas of Ayurveda, whose legendary contributions, withstanding the tribulations of time, has kept the spirit of science going till date, and still we are practicing science to an extent, of course, without any compromise. So my topic of today is current practice of Nasya, a critical review. the very essence is the very essence of the topic, a critical review, is because I think we have Panchakarma PG in many colleges across India. We have been learning Panchakarma for many years, right from our BMS dates and all. But are we practicing this Kriya Krama as intended in Shastra? And are we witnessing the response of these Kriya Krama as intended? Are we compromising at some or the other points? What are the things that we need to understand before we decide a particular Kriya Krama to a particular patient with respect to the Samprapti? I think it is these points which I would like to share my thoughts with you, because as far as Ayurveda is concerned, the more and more you try to understand, the more and more you try to know you, the more and more you realize ki you know very little. And as we move on, take on our journey from understanding the Samprapti and its role with respect to any Kriya Krama, we try to unveil many points when we try to understand it at many aspects. So I think it is those aspects which I would like to share with you all. So best wishes from Ashtangam Ayurveda Vidyapeetham. Ashtangam Ayurveda Vidyapeetham is probably the latest Ayurveda medical college in Kerala. It is the newest college. 2000. The college has started only in 2000. First batch is only 2016 batch. So it is the 18th Ayurveda medical college. It's situated in a serene atmosphere in Palakkad district of Kerala. So all of you are welcome. When we overcome this COVID pandemic situation and all, welcome to Ashtangam at any time. We are here to host you. So let me directly point out, as a physician, as a practitioner, as a teacher, as a faculty, or as an Ayurveda student, what is the most important thing that we need to face is nothing other than facing a patient in the OPD. So let me invite your attention to a few of the clinical scenario which we will be facing. For example, a 28-year-old female patient comes with a headache continuously, especially in the morning. And on inquiry, she says the pain was there for almost 2 to 3 years continuously. On inquiry, a little bit of Agni Mandam is there. Patient communicates about Gauravam, Tiktasyata, etc. If this is the clinical condition, can we as a physician think, is there a role of nasia to it? And if at all, I think, of course, there is head, Urdha Jatrugada Vikaram, definitely Nasyam has a role. I'll think of Nasya. If yes, which is the Nasya that I can give? Will it be a Anutaila Nasyam? Or should I go for a Tulasi Patra Swarasam Nasyam? Or should I go for an Ardraga Swarasam? Which one should be the important one? And if at all I go for any of the Nasyam, how much should I ask the patient to put in the nose if I'm doing it in the OPD level? Is it okay if I go for 2 drops, rather 2 bindu? Or and if at all, at what time the patient asks doctor, morning or evening or afternoon? So these are all the practical things that we face in the OPD. And as physician, when we try to understand or when we try to execute a Kriya Krama, it becomes important for us to do those things in the basis of principles as laid down in Shastra. So how well we can do that, we need to ponder. Now, another case scenario. A well-built 55-year-old businessman comes to you and he complains of sleeplessness for a long time. He's having stress, anxiety, some loss and well-named businesses and all. So I try and IP, okay, somebody and everyone, he comes to us and say, doctor, for anxiety, stress, I have heard Shirodhara is much better. So the patients come and tell you, no, I want Shirodhara and all. So we go as intended by the patient, we ask them to undergo, we will make them undergo Shirodhara. Okay, Shirodhara with Taila or Kshira. Okay, anything according to the doshic status. Okay. But even after Shirodhara, his basic issue of sleeplessness continues. There is no much result to Shirodhara. We think Shirodhara will have some result with sleeplessness. Now, what is the issue? In such a situation, can there be a possibility of using Nasyam? Definitely, there is a possibility of using Nasyam, which we need to ponder again. Now, another case, a case of 20-year-old male boy presenting with premature graying for almost 1 to 2 years. A young boy out of his +2 and all going to join a degree college. He says, come to you and says, I'm having gray, you have to correct it. Now, in this situation, can Nasya play a role? Because, you know, clinically, where should we apply Nasya, at what state, and to which best situation we could do that. So if there is a role of Nasya, which one should I go? Should I go for a Prapoundarikadi Nasyam, or should I go for Neeli Bringadi Thailam? We have, can I use Neeli Bringadi Thailam? Bringajaja Swarasa Nasya, it has been told in Chikilsa Manjari. Can I use Bringaraja Swarasa Nasya to that patient? Nimbasavam Nasyam. Asava has been told to be a medium of Nasyam in Shodhana Nasyam. So can I use Nimbasava as Nasyam? They are using it. So how much, how long, again, are the questions that we need to decide. Now, another scenario, a patient who is probably 70-plus-year-old male, a known case of IPD, idiopathic Parkinson's disease, who is presenting with tremor, bradykinesia, rigidity, and already on Syndopa, Parkin, Ropark, etc. Now, in these conditions wherein we could feel a difference of higher mental functions and all, what exactly is the role of Nasya? Can Nasya be a part of the treatment that we decide for the patient as a preventive or a curative? Now, another scenario. So see, we move on from a premature graying to a neurodegenerative disease, to a headache, to a sleeplessness, which actually have got their manifestation in different systems, basically. Now, case 5, you know, this is an emergency situation. A patient got admitted to the casualty with right side weakness from morning. Today morning, you are in the casualty. And there is a patient who is probably 50-year-old female, okay, a known case of hypertension on irregular medication. She is coming with a presentation of right side weakness, and of course they are communicating about progressive loss of consciousness. So we know when there is loss of consciousness, I think what emergency, in emergency, what can I do? Definitely Sapnya Sthavanam, Murcha, Sannyasa, Mada, etc. Nasyam definitely has the role. So should I go for a Nasya at that time? How should I decide whether we can go for a Nasya? Which Nasya to be done? How much to be done? What to do at that particular point? It is these things that we need to practically face in our practice. And when we do these things, it's important rather to do these things. We will be discussing what are all the guidelines that is laid down in Shastra, so that we can be able to decide these questions or find answers to these questions in the most best way, probably. So I think keeping this clinical scenario in the mind, keeping these clinical situations in the mind, I'll be proceeding with my presentation. So Nasyam, as you all know, is one among the Panchakarma. We always think we have only 3 doshas, okay? So we need only 3, Vamanam, Virechanam and Vasti. Then why Acharya again mentioned about an extra thing like Nasyam among the Panchakarma? Even though 3 doshas, we have 5 karmas. So what's the role of Nasyam? So definitely when Acharya says Nasa hi shiraso dwaram tena tadvapya hantitan, that is Nasyam. The role is through nose, which is a Shirasa Dwara. So Shiras has been considered as a separate entity which is moved away or moving away or has got its own existence away from something called as Koshta. And Koshta is something, that route which we can manipulate. So there is a route through which we manipulate through Vamana, Virechana, Vasti and all. But there is a part in the body which requires not only manipulation through Koshta, but some other manipulation to address its pathologies. Probably it is this reason that it is this reason that they have actually explored the possibility of a procedure called as Nasyam, that we really need to understand. And you know, when we are moving through chapters, for example, Ashtanga Hridayam speaks about Snehana, Svedana, Vamana, Virejana, Vasti, Nasyam. So there is no role of Nasyam without Koshta Shodhana too. So whenever we speak about manipulating a Urdhva Jatrugada Vikara, we definitely have to, when we are thinking of a patient in Ayurveda, patient with respect to Ayurveda Sharira, when we are manipulating the patient by ourselves, the most important aspect, especially as Panchakarmis, when we are manipulating anything through Koshta Shodhanam is very important before Nasya too. So that order wherein Vagbhata says about Vamana, Virejana, Vasti, Nasyam, And even if only after Nasyam Gandushadi Vidhi speaks about Murda Taila. So we have to have this idea that when I am thinking of a Murda Taila, when I am thinking of a Shirodhara or Shirovasti, etc., it's important that I already make the patient undergo a Koshta Shodhanam or Urdhva Shodhanam, and hence role of Nasya generally would always be after clearing out the Koshta. This we need to understand or always keeping in mind. So Nasyam is not just simply nasal drops. Many a times I have seen people saying, what's Nasyam? You know, putting 2 drops in the nose. It's not just simplified. Probably it is the most simplified version of the procedure which we can communicate to the layman probably. But actually Nasyam is a well-designed functional intervention. We are intervening the functionality of the patient at various at different levels of existence of that being as sharira, that we would say. So when we think about the historical background of Nasyam, we could see, you know, Lord Buddha Jivaka speaks about giving Virechana Nasya to Lord Buddha, Sanjeevani for Lakshmana and Ramayana. So this, what you call it as this root of nose was manipulated from eons. The history speaks so. And there is no doubt that how well Acharya has very specifically spoken about Nasya, or Acharya has very specifically designed this process in a way that it can be manipulated to correct the functional derangement that has set in the body. So my presentation, I would like to, you know, speaking about there are 4 types of Nasya or 5 types of Nasya according to Charaka, 3 according to Vagbhata. This is the procedure. I think that's not needed at this present point. Rather, we need to discuss what are all the critical aspects that we need to discuss as Shastrarthis probably. So I'll be discussing at 3 levels most probably. The mode of application, the dose standardization, and the practical clinical application which we need to work out. Because, you know, many a times I have seen people practicing like 10 drops Nasyam, 10 drops each nostril, 3 drops, 4 drops, when Acharya at no point has spoken about drops as the matra. Rather, he very specifically mentioned about bindu and how to measure a bindu with respect to the circumference of your anguli. So he has spoken, rather he has given us some guidelines understanding all these things, and how well are we practicing those things which we need to understand. So each Kriya Krama, whether that is Nasya, Vamana, Virechana or anything, is actually a very sharp double-edged weapon for a Ayurveda Vaidya to combat any of the disease. So it is actually a treasure of immense possibility, but the fact remains that yet we explore very little too. For example, Virechana still Avipatti and Erenda Thailam are our favorites. Vamanam still Madana is our favorite. I mean the common thing, okay. Vasti, Madhudailika Vasti, maximum Vaidarnavasti, Shiravasti, Yapanavasti, wherein Charaka speaks about more than 500 Vastis in Siddhasthana itself. So how, what you call it as, how well are we exploring the possibilities told in our Shastra, which we need to work upon. So probably the reasons why we are unable to explore the full potential of each Kriya Krama, because we are unable to give very specific outcome most probably, and the reason could be understanding Kriya Krama with respect to our Sharira. We may met many point, you know, when I do Abhyanga, what is happening, it is anti-inflammatory, it gets absorbed, all these things we may think or we may try to understand. When I'm pouring Nasya, we are improving lymphatic circulation, improving vascularity or neural transport, etc. we may discuss. Then what's the difference between when I pour Anutaila or Karpasyastradi or Sahasradi? When I pour Sahasradi 8 avarti, 7 avartis or Sahasradi 14 avarti, what's the basic difference? So these kind of aspects, you know, we will be able to speak up only, you know, when we understand our Sharira. When I speak of our Sharira, I think, I mean, I speak about that Sharira, which includes Dosha Dhatu Mala Moolam Sada Deha Satyam Chalaha, the background of Dosha Dhatu and Mala, and Sharira Indriya Sattva Atma Dhari. So Sharira, the being with Sharira, Indriya, Sattva and Atma. So probably Atma that we may not be able to manipulate, but the Sharira Indriya Sattva, which is a conglomeration. So when a patient is sitting in front of us, I'm seeing an individual with Dosha Dhatu Malam, Sharira Indriya Sattva. So these 3 aspects which has to be understood, has to be inside us so that we can decide what we can do. And at the same time, analyzing Samprapti and Hetu. Because, You have a headache coming to you. Okay, we think of it as headache. Now, many a times headaches, chronic headaches or migrainic like headaches respond to Chirvilvadi Kashayam and Dusparshakadi Kashayam, which is intended for Gulma Arshas in our practice, because why, in all those headaches we could see the samprapti of Udavarta in the background. So unless and until I correct Apana Vayu initially, without correcting Apana Vayu, I think of Prana Vayu and I ask them to apply something external or give some Shirashula Vajrarasam or something like Migragot or something, nothing is going to have a permanent result. Rather, when I do Koshtanulomanatham to a great extent, rather when Koshtanulomanatham is the basic cause for causing the Urdhva issue with Pranavayu. So Koshtanulomanatham becomes important to correct even Pranavayu. So Hetu, understanding that Hetu. So in those cases, without making Koshtanulomanatham, I try for Nasya continuously. There will not be no reason, I mean, no proper result, at least sustainable result. So what is important for us is to analyzing the samprapti and hetu with respect to each clinical condition. Okay, so that is also a reason. So many a times we miss that. So and about that, I mean above, so once we think of our sharira, we analyze samprapti and hetu also, and then we decide a kriya krama. Then what happens is, when we decide a kriya krama, how that kriya krama is executed in the body. When a patient is made to sleep, patient is made to just come down and then lie on the bed just like that and put 4 drops on each nose, and he's just asked to just inhale it, okay, and then you spit it out and go off. Is this the methodology told, or if you do things in such way, will the intended result come out? So how the procedure has to be done at which particular point is also equally important, which probably many a times we miss, because many a times kriya krama or nasia and all are done by therapists, not by the physician themselves. So probably you write 5 drops each nostril, therapists do the nasya, they do it and go, that's all, no assessment, nothing. So it's very important that all the panchakarma, kriya krama, whether it is vamana, at least probably purva karma may require physicality more, but at least vamana, virechana, vasti, nasya, everything has to be done by the physician itself, because each and every assessment at every point is very important. Now, when we think of any samprapti is never a stagnant thing. It is a continuous process, it's flowing. It may start from jwara, then continue and try. And, it may start from jwara when we nidanas is continue. When it is moving towards Madhyama Roga Marga, the nidanas are more specific to Madhyama Roga Marga. It can become Vadrakta. When the nidana is more specific to Bahya Roga Marga, it may become Kushta. So the samprapti moves on as nidana continues probably. So it is very important that when we are applying any kriya krama, to understand where actually is the samprapti moving on. Many a times in my clinical practice, probably when a patient comes with you to multiple issues for a long period and all, we start kriya krama. Actually the application of each kriya krama that gives you more idea about what actually is the samprapti throughout, probably. Okay, so when you try sadhya vamanam, considering it to be kabha dominant, but the patient does not vomit at all, you understand, then you understand there is no what you call it as, our assessment is wrong, this is not kaba, there was somewhere vayu more in the background which has to be considered probably. So these aspects becomes very relevant. So understanding samprapti also is very relevant before we apply any kind of kriya krama. So ultimately, the mechanism of Ayurveda is nothing other than understanding gunas, and doshas are nothing but a group of gunas. Tatra ruksha lagu shita kara sushma shalo anilaha. A group of gunas are doshas, nothing other than that. So what is dosha is actually a group of gunas that has been understood in the matrix of dhatus and malas. So we have a hollow koshta, we have a dhatu around, and doshas are nothing but the matrix of gunas that has been distributed at different forms of dhatus. For example, in Pakvasha, you have more ruksha guna. In Uras, you have more snigdha guna. In Shiro, you have all the things. You have Alochaka Pitta, you have Pranavayu, etc. So understanding this particular aspect of Ayurveda, I mean, this particular aspect in Sharira is basically Ayurveda. So what is Ayurveda is doing is understanding this gunas in the body and trying to manipulate it through different Kriya Kramas. For example, if there is Snigdha Guna more, we do Valuka Sveda. If there is Ruksha Guna more, we use Taila, simple logic, okay, I mean simply, okay. When things become more complex, there are some different combinations and permutations and combinations. So so when I think or decide to use whether should I go for a Swarasanasya or should I go for a Tailanasya or should I go for a Tikshna Tailanasya, it is this aspect of Ayurvedic methodology that we need to keep in mind rather than some other thing that may manipulate our thought process, because I feel these are the aspects which has to be our judgment criteria, which dosha, which guna most probably. So yuktivat prayogam, ultimately, as Mahadevan sir always says, life is nothing other than a movement from Ushna Snigdha to Shita Ruksha. Life is Ushna Snigdha, death is Shita Ruksha. So Ushna Snigdha, controlled Ushnatvam is most important. Ushna should not be high. At the same time, Ushna should not be low. Snigdha Sneha Saro Ayam Purushaha. So Snigdha is that which maintains life, but controlled has to be there. So that Ushna, maintaining that Ushna Snigdhata is actually the role of our various Kriya Krama, whether it is in the form of various Snehana or Svedana. Probably many kind of Svedas are told, 13 types of Sveda, etc. are told. It is basically based upon this understanding or making of the controlled Ushna Snigdhatva in the body, so that the body can continue its life in a controlled fashion without moving on to Shita Ruksha, even though the situations may be like that. So this mechanism that plays its own role in Ayurveda has to be understood when we are deciding upon any of the Kriya Krama. So understanding any roga with respect to Vyadhi Nirupanam, Vikara Prakriti, Samprapti Nirupanam and Hetu Vishesha should be done definitely before we analyze or before we decide upon any of the Kriya Krama. There is no doubt about it. So Vyadhi Nirupanam, Vyadhi, the Vyadhi which we have to be understood about Vikara Prakriti, what exactly is the Prakriti of Vikara, and the whole Samprapti and Nehetu Vishesha. So without this, I don't think we'll be able to do any kind of Kriya Krama, so which is very important. So when we come to Nasyam as a group, specific guna of Nasya as a preventive, promotive, curative treatment, it has been told. Wide range of drugs, formulations, dose and dosage forms have been told. Best for diseases and pathologies lying above clavicle, Urdhva Jatra Vigara. And it is actually the only Panchakarma that has been mentioned as a part of Dinacharya. So among this, all those have been told in Rutucharya probably. As Dinacharya, only Nasya has been told. And you know, Nasya is effective in local and systemic diseases. Treatment for Manasika Vyadhi, Nasya has got a role, its own role, because you know how Sattva has got its own role with something called as Shiras and all. It has been explored to a great extent. And emergency situation, probably Nasyam and Anjanam are the Kriya Krama that which we may be able to understand or which we may be able to manipulate. So when we speak of Nasyam, definitely nose comes to us, our mind, and nose, you know, the nasal vestibule, middle turbinate, superior turbinate, nasopharynx, etc., the structure of nose. But as Ayurvedist, when we are speaking of Nasya, the most important thing that has to be inside us is Murdha, which is a part of Pranavayu, which has got this sthana of Pranotra Murdagaha, Netra Alochaka Pitta, and Tarpaka Kapha. And Nasa, which is an Indriya Sthana, as well as Grana, which is a Kabasthana. So with the dominance of Prithvi Bhuta. So why Nasyam has been specifically told as an important Kriya Krama with special reference to Urdhva Jatrugata Vikaras, there is not only Urdhva Jatrugata Vikaras, even many systemic diseases, because Nasa as a opening to the Shiras, and Shiras being the important one among the three marma, and with all these points. So this, you know, we always have to be keeping in mind. So exact utility of Nasyam, when a patient comes to us, we have to understand 3 points, I feel. Nasa hi shirosodwaram tena tadvyapi hantitan. We know. So the Nasa is the shirosodwaram. So any issue with the shiras, Nasya can be a possibility. Medo granam cha jihva cha khabasya sutaramuraha kabasthanam as told by Vagbhata. So he says medo granam cha jihva cha. So granam is a kabasthana. So any disease of kaba, Nasyam can have a role. Okay, in general. Now, you know, when we are speaking about Nasyam and its relation with Shira, when it comes to Shira, we need to understand the Samprapti that is presenting in Shira is Swatantra Samprapti of Shiras or Paratantra Samprapti of any other disease in Shaka or Koshta, and we have a Shiro problem. For example, this thing, as I told, migrainous attack, we have many times observed it is Koshtagata Apana Vayu Vaigunya over a period that will lead to migrainous people. Probably we'll all be, when we analyze the Koshta of migraine patients and all, will be having these issues. So Paratantra Samprapti is resulting in this Shiro manipulation. Probably direct Nasya will not be having a positive role. Only once Koshta Shodhana is done, Nasya will be having a role. When Swatantra Samprapti has its own role in Shiras, like some Abhishanda of Netra, etc., definitely Nasyam will have its own role. So any Kabadushti in general, over a period, definitely Nasyam can have a role, and Swatantra Paratantra background of Shiras or Shiro related issues. So exact utility of Nasyam, we can speak at that particular level of clinical spectrum. So now when we come on to the application of Nasyam for practically in the ground, what are all the situations that a clinician face? First thing, Nasyam in which all conditions to do, where to do. Second one is when to do. Okay, at what time to do, morning, afternoon, after food, before food, etc. How to do, how much to do. So probably all these things we all may be knowing. I mean, we have already learned many things where, when, and so I'll be discussing only those aspects of the things which need a discussion, probably which need more consideration as far as my limited clinical experience is concerned, which I would like to share with you. See, Nasyam as a process itself indicates nas gatau, nasa gatau vyapto or pervasion. That means it has got a movement from one particular point to another point. So the importance of this being the only shodhana for Urdhvanga, less quantity of medicine is thing. The only part of nervous system that has got direct link with the external atmosphere, probably we could say, is the olfactory epithelium, and it can produce rapid effects because, as I told, it is one of the indriyas. And you know, when we are able to manipulate indriyas and indriyasthana, the result will be spontaneous. And we can definitely say we can overcome probably any kind of koshtagata things like gastric liver secretion when we are considering the importance of nasya. So now about classification, all may be knowing, how Nasya is classified. My intention or interest was in why did he classify this format? You know, when Charaka classifies it as Navana, Avapidana, Dhmapana, Dhupana, Pratimarsha, and with respect to action, he classifies it to Rechana, Tarpana, and Shamana. Vagbhata, as you all know, it classifies it to Shodhana, Shamana, and Brahmana. So, you know, with respect to mode of action, he makes us to understand. With respect to mode of administration, like which medicine that you are supposed to use. If you could use dhuma, you know, it becomes dhupana. If you are using churna, it becomes smapana. If you are using swarasas, it becomes avapidana. So when he is classifying in these aspects of mode of action, mode of administration, parts of drugs use also he gives us. That means as a physician, when we are deciding upon nasya to be done, we need to first decide which is the type of karma that I am intending in that patient. Am I intending a Shamana Nasyam, Rechana Nasyam, or Brahmana Nasyam? Now, if I am intending a Shamana Nasyam, should I go for a Sneha Nasya like Navana, or can I have any kind of Swarasa in that condition which is more suitable to the Samprapti? So mode of administration comes. And even when mode of administration comes, he gives us guidelines of which part of the drugs that can be used probably. So probably Falapa, Marga, Pippali, Vidanga, Tulasi, Saptaparna, Kushta, Vacha, etc. he speaks. But in many of the things, this Kushta and all, Haridra, Kanda, we definitely use Haridra, Churna, Shumti, Lashana for Nasyam. So even though all these things are not used, but many things we apama pippali vedanga I have seen using, tulasi I had seen using, haridra shunti, lasuna I have seen using, nimba I had seen using, guduchi I have not used, tejavati I have not used, seen. Hingu I have seen being used, not Laksha. But of course, Acharya gives us the possibility, probably with respect to the Samprapti. Okay. Even when Susruta, when it comes to his classification, he basically broadly divides in Shirovirechana and Snehana. Shirovirechana, Prathamana, Avapidana. Snehana as Pratimarsha and Masya. So see, so basically when we are trying a Nasya, both things, two things can come to us. Okay. One is Shiro Virejana, wherein Shodhana is needed broadly, and Snehana. Charaka gives us it into few more things as Tarpana or Brahmana, Shamana and Rechana. So whenever we are considering is Shiro Virejana or Shodhana, so naturally it can be either Pradhamana or Avapidana or any kind of Tikshna Snehas. Now when I am speaking of Snehana, in Snehana, I can decide with respect to dosage, how much Sneha I can give. So according to that, he gives us an option of Marsha or Pratimarsha. So when I see a patient who is very Avara Sattva, Avara Bala, and he may not be able to, so he may not be having this much of suitability of using a large kind of, a higher dose, Pratimarsha is a possibility in that case. But when I see a patient who is quite balavan with all doshas also higher state, and he'll be able to tolerate Sneha Nasya in a higher dose, Marsha is the possibility. And Snehastu Marsha Pratimarsha. Marsha and Pratimarsha, the classification of Nasya with respect to dosage is basically a classification of Snehana Nasya. There is no Marsha or Pratimarsha Nasya with respect to Pradhamana or Avapidana. No, even Vagbhata Charaka has not classified it. That means whenever we are doing it with Avapidam and Swarasa, it will always be Tikshna. Whenever we are doing with any kind of Churna, it will always be Tikshna. So Tikshnatvam definitely defines Shirovirechana Nasya, and Snehana or Snigdhata, because we are manipulating the Vata aspect of the condition, it decides the Snehana kind of Nasya. Now Vagbhata again the same, Virechanam, Shamanam, Brahmanam, similar to Charaka, Snehana Nasya according to dose, Pratimarsha and Marsha. So different authors have supported. So when authors, I used to think why these people are giving so much of classification, what is the need of that? But the thing is, every physician, when they were practicing this and they could find out what are all the criteria that they were convinced with respect to probably their practice, they have inculcated. So each classification actually gives us a guideline basically to practice. It is not just to grasp or by heart it and only write for exams probably. Now let us see the types and its relation with clinical scenario. So when I am analyzing, see, most of us, many a times what we do is we practice probably, I think at least in practice of Kerala, which I am more exposed to rather, I don't know much about how things are practiced outside. Anutailam, Dhanvantara Tailam, Shirabala Tailam, Shadbindu Tailam. Shalakim practitioners, in exclusive issues of Shalakim, they practice many different medicines. But whenever it is coming to a general practitioner in purview of Kaya Chikitsa, and mostly, okay, probably 70 or 80%, these 4 to 5 Sahajradi Tailam, these Shadbindu Tailam, these 4 to 6 medicines are the common things. So, and of course, very few different studies have been done with respect to Tulasi Patra in Jingam and Shunti and all. But not very commonly practiced. Okay, so but the sense of classification told by Charaka, as I told you, is to understand the how can we clinically select things. When he says Navanam, Chavapedam, Mapanam, Dhumam, Pratimarshamscha, 5 types of Nasyam, and Snehanam, Shodhanam as 2 types of Navana Nasyam. He gives us this clinical guideline, the reference from Charaka. See, Stamba Supti Gurutvadeyaha Shlaishmikaye Shirogada Shirovirechanam Teshu Nastakarma Prashasyate. So whenever we are having Stamba Supti Gurutva, can be a clinical thing in an OPD practice. They are presenting with any of these conditions with respect to Shirogada or generally, Nasya can be a possibility. Vatatmaka Roga, Shirakampa Arditadeyaha. So when Shirakampa is there or Arditadi Vatadi Roga, definitely snehana nasya is be a possibility. Now see, rakta pittadi rogeshu shamanam nasyamishyate, very specifically, okay. Brahmanam nasasi soshe vaksange kritsrabode apabahuke. When he speaks about Brahmana nasya, Vagbhata says nasasi soshe kritsrabode apabahuke vaksange. So all neurological vata presentations comes under Brahmana or Tarpana nasya. At the same time, Shamana, Nilika, Vyanga, Keshadosha, Akshirajishu by Vagbhata. Keshadosha, Akshirajishu, Nilika, Vyanga. Pitta Rakta dominant issues. So generally in practice, whenever Rakta Pitta we find in the background, Shamana Nasya, whenever Vata plus presentations, Brahmana Nasya, whenever Kabha Vada presentations, Shodhana Nasya. So this can be a general guideline. And he says, Dmapanam Dhumapanam cha tadha yogeshu shasyate. So Dmapanam, according to Yogyata, we can think of it. So for example, the first presentation, the patients that I've seen about like a premature graying student, the guy with premature graying has got Vata Pitta Dushti in the background. So naturally what will happen? We have to think of a Shamana Nasyam. Okay, definitely Rakta Pittadi Rogeshu Shamanam. We have to think of a Shamana Nasyam. Somebody is having the first lady with say, severe Shiro Gurutvam and Gurutvam etc. Shlaishmika's presentation. Then we have to think of Shiro Virechana Nasyam. There is no doubt about it. And the Murcha conditions of the patient, which has been manipulated by the patient. One second. The Murcha patient, which at that particular time, Dhmapan and Dhumanam cha tada yogeshu shasade. In those conditions wherein Yogyata has been told, Dhmapanam and Dhumanam has to be done. So whether it is indicated for Dhmapana or Dhumana, which we need to understand. Okay. So whether that condition was exclusive Kaba dominant when that patient was having loss of consciousness. So it is our practice in stroke cases, if we are very sure that it is not hemorrhagic, it is infarct in the background, like presentation of more Samprapti has got more Kavata Kava, Dhumanasya or Dhmapana, not Dhumanasya, Dhmapana Nasya with Pipali Churnam, Rasna Churnam, for decreasing the Tau Pravesha at that time is much better and has been practiced in those conditions when we are very sure. But it is, if it is Pitta dominant background like hemorrhagic strokes, we should not be going for any of those things at that time. Probably Manjishtadi, Kashaya Dhara, etc. are useful in that background. So understanding the Samprapti becomes very important, and for that the guideline probably we have to understand from the guidelines told by Charaka. So Navana Nasya divided into Snehana and Shodhana. So the common things of that we practice is Karpasya Stadi, Anu Taila, Yashti Taila, Dhanvantara Taila, Shadbindu Taila, Gandha Taila, Shiravala Taila, the common things which we practice, which we will be discussing later. Now, of course, the dosage which we will be discussing later. The Shodhana Nasya, again, Shodhana Nasya has been told by Taila used, but using Tikshna Dravyas like Pippali, Shigru, etc. So again, the matra has been told a little less for Shodhana Nasya, as we all know. And our Pidaka Nasya is nothing other than the Pidanam has to be done, that is using Swarasa Nasya. And you know, if we are using Pitta Hara Swarasa Nasya, definitely Stambhana. You know, for epistasis and all, there is common practice of using Durva Swarasam along with honey, or Durva Gritam just immediately when the patient is having epistasis. Durva Swarasam is put with honey in the nose, or just Durva Gritam is made to inhale and the patient is made to sleep with head down position. The epistasis stops, which I have also seen and done in 1 or 2 cases. So Avapidaka Nasya, Shodhana and Stambhana. So Stambhana we have to understand it in the Paitika background. And how Avapida is done, probably we all know. It has to be Swarasa drug has to be taken in a wet Tulasi Patra, mortar and pestle, and clean white cloth is very important, because and then only there was a study at Government Ayurveda College Trivandrum wherein Nasyam with the Tulasi Patra Swarasa and Ardraga Swarasa. Okay, comparative study along with honey. It was done as a Swarasa in sinusitis cases. Okay. So preparation of the medicines becomes important in those conditions. And when it comes to Dhmapana Nasya, it is, you know, Churna Nasya, and using Churna Nasya probably we'll be discussing the clinical scenario. So when he's speaking about Pradhamana, how to use it, he speaks about a Nadi Yantra of length 6 angula. That is the technology that he speaks. You have so much of medicine so that when you blow it through an angula of, I used to think why he might have told about a 6 angula Nadi Yantra. You have so much of medicine that when you blow it, it reaches properly. Because, you know, when I was doing it in a case, we used a straw for doing it. So when the straw was a longer straw, it became difficult. When the straw was very small also, it was difficult. So almost this much straw was actually apt for making the medicine get into the nose actually. So straw, we cut at the end and put the medicine in the this side, and then we keep it and we blow it basically. I have done it in stroke cases, comatose cases. Okay. So Pradhamana Nasya, Pipali Churnam, Trikadu Churnam, Shunti Churnam, Vilvadi Kutika, Rasnadi Churnam, a few cases which are done with the discussion, after discussion with Dr. Ravi Shankar Parvaje sir. Probably everyone might be knowing about him, who practices in Karnataka, I mean Puttur, Karnataka. So I had done a few cases of neuro cases after discussing with him, and he's taking his advice in doing those, which I'll be sharing later. So when Acharya speaks about Mapana Nasya, you know, he speaks about 3 Muchuti, he speaks about 1 Shukti of Potali. So all these, you know, apart from clinical aspects, how technology they have developed, you know, to give a medicine in a very churna format. How can we do that? Either you make it through a pill, or then you may, otherwise you make it into Sukshma Churna, make a Potali, and then use it. You know, in many a times what I do practically in Parkinson's cases, I have a neuro OPD over here and we run that basic. So in those cases, Vilvadi Kutika and Rasnadi Churnam, both of them are pounded and made into a small potali. And like under the background of like a Pratimarsha Nasya and all, we make them to just have it, inhale it every morning and night. Okay, when we discharge the patient after IP treatment. So when they do it for a longer period, you know, they'll, you know, initially anosmia will be the case, probably pranavayu affliction might have been triggered at that particular time. So over a period, they say my smell has improved and all, and we also see the difference of clinical outcome with respect to the conditions too in these cases. And Dhumanasya again, it's very beautiful that how he had spoken about liquid, I mean solid state in the form of Dhmapana. He had spoken about liquid content in the form of Bindu, and then he is speaking about Dhumana. Okay, this gaseous state of medicines is manipulated by using for Nasya. And how to quantify Dhumana, it is again difficult. So he was very, I mean, Acharya was very intellectual, I feel, you know, because you make so much of medicine that it can come out through 24 angula. So to quantify Duma, he has specified the length, the difference of length about angulas, okay? Prayogika, Snahika, Vairechanika and all. So probably, but I have not used all these criteria in, we have specifically, but Snahika, Dhumana, either with we apply Grita and other dravyas in Snahika, and we have applied dry dravyas, etc. with respect to Prayogika, the common things that we do. And we, the Hukta kind of things was can be considered as a, what you call it, as an extension of this Duma kind of thing. And these are the practical things that we use, you know. Dhumavarti, probably everyone will be knowing. The Rasnadi Dhumavarti, Haridra Dhumavarti, Gugulu Dhumavarti and all. Like for example, Gugulu Panchabala Churnam is made into a paste by boiling Gugulu only. We have a milky secretion when we boil Gugulu, and then we roll the gauze into that, and that is made. And then we, in cases of Vrana and all, we do Dhupana with that basically. Similarly, when there is fungal sinusitis and all, this is used as Dhumavarti, Rasnadi Dhumavarti, Haridra Dhumavarti, usually after any Nasya or Vamana and all. And this material, putting 2 sharavas and quantifying so much of medicine and using the tube can be a methodology to practice Dhuma as a process. But I don't think the full, what you call it, as the full utility of Dhumapana as a clinical speciality with respect to specific utility in clinical conditions has not been explored too much in our community. But I've seen many senior physicians who, like some senior doctors from AVP Coimbatore, in a discussion, he was saying, whenever patient does not respond as I think or as I feel, I ask Dhuma to be done finally, okay, because Dhuma has got some special affliction towards bhutas and a higher mental function, I feel, and especially in Unmada cases and all, he says, and the patient who is much violent, he becomes silent, patient who is more depressive becomes much better. So that was his clinical experience sharing. So Pratimarshanasya, probably all of us we know the Pratimarshanasya, where it can be done. And the most important aspect is Pratimarshanasya is a part of Dinacharya. And how many of us actually being Ayurveda people, how many of us actually are practicing Pratimarshanasya daily? Even though Acharya says about 14 Pratimarsha Kala. And there is very simple, putting each drop in the nose and then you do it, that becomes a process. But Charaka very simply says Nastaha, this has to be a point that we need to understand. Nastaha sneha angulim dadyat pratarnishicha sarvada. You need not only always nacho uchinge daroganam pradimarshaha sadardegrade. You need not have uchingana, that means you need not inhale it continuously. You just apply it in the anguli and then you do it. That itself is enough for the Pratimarsha. And I was called to take a class to a group of allopathic doctors from Italy on Vasti. So when I was here in Thrissur, okay, so SNA Aushadashala, they run a course of interaction with allopathic doctors from Italy. They have a course called Ayurveda Point in Milan, which is run by a neurologist, Dr. Antonio Moranti. Probably many of you might be knowing. He is a modern neurologist who has got who is also trained in Ayurveda, and he teaches there. So that group comes over here. So when I went there, actually, I could see after their food and all, everyone was having Anutailam in their hands during lunch session. So I was there to take a class on Vasti. So I was wondering, what are they doing with Nasyam? So all of them, they were applying Anutailam on their hands, and they were doing after food, and I was like, I was so happy because we don't see any Ayurveda college physicians or even Ayurveda students practicing this Nasya in the morning or even after food and all, but they were doing it actually. Because Westerners, since they don't have any prejudices, they follow whatever we say and they believe in that. Since we are actually pseudo people having all prejudices, we learn something, we believe something else and all. So what we say and practicing it becomes, there is a gap. Probably that's one of the reason that the state of Ayurveda is not that good. Anyway, we'll not go into that. But anyway, Charaka says about Nastaha Snehangulim Dadyat Pratar Nishicha Sarvada. So just apply it and you just do it, you just inhale it. Even that can be a method of practicing at least Pratimarshanasya. So Pratimarsha Kala, see, when why did Acharya speak about so much of Pratimarsha Kala, 14 Pratimarsha Kalas, the contents, as you told, Diva, Ratri, after Bhukta, after Vanta and all, after Shrama, Maithuna, all these things are actually the clinical, the conditions of it, physiology, which makes body stressed, under stressed. So any physiological thing due to any reason, whether we have a food or we are overworking, we are having adva, shrama, etc. When the body is under stress, to combat or to recoup the body, he is telling Pratimarshanasya in Dinacharya. So it is actually to maintain health. The Vata Kopa that happens in your body because your body has come under stress because of adva, shrama, or eating food or vanta, etc. That Vata Kopa at that moment is pacified by using Pratimarshanasya. So it is actually to improve our health, nothing else. So that was the intelligent technology to maintain the body, probably. Okay. So whether Paanchjanya, Gandusha, Murtha, Taila, Anjana or Varchavages, in all these things he speaks about Drigbala. Even this is coaxing the body in one or the other way when we are doing Pratimarshanasya. And Toya Madhya Garasnigda Pitanam Patamichitam Bhukta Bhakta Shirasnata Snadukama Srida Shayat, probably the contraindication of Nasim, everyone know, which I am not going into details. But we have, when I do it in practice, Nasyam in OPD, people, do Nasya and immediately go for head bath and all. They complain about some kind of Pitta Kaba, Vishanda and all, later they come. So all these things, we in practice, we see if we don't think of contraindications to a great extent. So this was about which type of Nasyam we need to do practically and how to do. Now, second, coming to when to do, it's very important. Pratah Shleshmani, Madhyane Pitte, Sayam Nishostale. So when Vata is dominant, evening has to be done. So Pakshagada cases, which come to us as rehabilitative treatment, evening is the best possible thing. And Kabhaja, morning has to be. So in all sinusitis or acute Pakshagada, we do it in the morning. In all chronic things or conditions, we do it in the evening. And Pitta, afternoon. Generally, a few cases of nasa, this thing, epistasis like conditions only, I have done it with Durvagritam and Shatadautagritam, that we do it in the afternoon times. Okay, other than either in the morning or evening is very important. And according to season also, it's very important. Then it is when it is raining to a great extent, we don't do that. And when there is Vata Kopa, more of this thing in the background, Kabha in the background, morning only it's good. When even Kala is much Shita, and Kalam, whenever there is Ushnatvam in the Kalam, evening is the best option, like Grishma. So we understand that, because many times I've also seen, when we do it is like Kabhaja, we consider it to be Kaba, but the patient has got some Pitta Prakriti in the background. We do it in the morning and all, he develop headache. When I turn it into the evening, patient will be comfortable. So when we are, other than the Dosha Avastha, the Kala also has to be considered when we are applying any kind of, when we are deciding upon the Nasya. Abhukte, the time in relation to food. So that is, there is no doubt, because only when Koshta is free, the Shiro activity can do it in the best possible way. So I've seen, whenever we do Nasya to a patient who is having food or without much gap, the patient vomits and the whole food comes out. So that is important. Abhuktavan is the basic situation. Now, the most important thing, which probably all, I don't know how far it generally it is practiced, how much to do. Marsha and Pratimarsha is the only classification based on Matra. And solid form, we use Churna, as I told, liquid form, we use Thylam, and gaseous form, we manipulate Dhuma. Now, he has spoken about Muchuti or Shukti when it comes to Churna. He has spoken about the length of the content or length of pipe with respect to Dhumana. When it comes to liquid, Bindu has been told as the Matra. Now, what is Bindu? Pradeshin Yanguli Parvadvayam Magna Samudradad A Samudradad Yavat Patatyaso Binduhu. Pradeshini Anguli Parvadvayam Agna. The Pradeshini Anguli, when we are dipping it, Parvadvayam. So that has to be dipped, and what is coming out, that is one bindu. Now see, Hemadri in his commentary of Ashtanga Hridayam, he says, Yavat patat yaso binduhu. Yavat patati tavat binduhu na prathama patati evaha. Hemadri says, that means when we are dipping it in liquid and what is coming out, if one drop is falling, that is not the only amount that has to be considered for bindu. Yavat patati tavat na binduhu na prathama patati. Total thing that is falling out is one bindu. So Bindu is the whole volume dribbled, not just the first drop. That means, when we practically say you have a Kshirabala bottle, 10 ml bottle, and you just ask it, you just do Bindu, 1 drop, 2 drop, 3 drop, that is not intended Matra. That is what I wanted to say. So a critical analysis of Bindu as a Matra, Sharangadhara has got a reference. Evam vidhehi Bindu sapnyahi ashtabhihi shana uchyave. So 8 Bindu is 1 Shana, he space. Charangadhara gives many additions to Panchakarma. No? When we move from Brihatrayi to Lagutrayi, and specifically Sharangadhara quantifies many things, okay? Like Sneha Matra, Dvabhyam, Ashtabhyam, Chaturbhi, Ashtabhyam, Yamaihi, Yaha, Kramata, Jiryanti. That is the quantity, okay? But when we come to Chakradatta, he speaks about 3 Karsha, 4 Karsha, etc. So as we move on, as Kala has moved on, subjective to objective things have come up. One such area is this, wherein Sharangadhara says about Bindu Pramana, 8 Bindu Pramana is 1 Shana, 1 shana is 4 masha, and in Ayurveda pharmacopoeia 1 masha is 1 ml. So 8 bindu is 4 ml, 1 bindu is 0.5 ml technically. Okay, so it is not just the first drop, rather when you are having a 10 ml bottle of Anu Tailam, it technically has, as far as our study is concerned, this understanding is concerned, it has got 20 bindus only. Okay, so a study was done at Kottakkal Ayurveda College, a pilot study of 30 samples between age group 18 to 60, wherein this mean age size was done, and it was found out to be mean bindu was 0.49 ml. Okay, and there were also many studies at different places. You know, Yogeshwar et al., the work is published, 1 bindu for Nasyam is 0.44 ml. 2012-15, there was a standardization of Kashaya Nasyam tried to be done at Government Ayurveda College, Trivandrum, Department of Panchkarma, wherein Kashaya Nasyam was found out to be 0.2 ml. So according to the density of the Dravyam also, the total volume of Bindu differs from the Dravyam to Dravyam, that we have to understand. You know, in 1979, Trivandrum Ayurveda College, Government Ayurveda College, actually, there one study was there. Role of Nasyam in Pakshagadam was that madam study, and she had actually not with this at that time. Statistics was not there. No, she had just taken 30 patients and she had just dipped this the same thing, and she had taken average 1979, and there her standard was almost 0.5 ml. She had come out to Dhanvantara Thailam. So when Ganesh has done his study at 2009 in Kottakkal, 1979 in Trivandrum, Sharangadhara in the 13th century, everyone in case of Thaila has come down somewhere near 0.45 to 0.5 ml as 1 bindu. So when we are trying for 2 bindu as Pratimarsha Nasya, 1 ml each nostril has to be put in each nose. So in a dropper, it has been found out that 10 drops is equal to 0.5 ml. So 10 drops. So 1 ml each nostril means for a Pratimarsha Nasya, 20 drops has to be put for each dropper actually. So, you know, in practice, we have 10 ml Anutailam bottle. We do Marsha Nasya for 7 days, still the oil will be remaining. So this is not the intended quantity of Nasya as intended by Shastra. So if we usually practically measure it in 1 ml syringe, and then we are practicing it. So when we have done up to 3 ml is the common thing. I usually start with 1 ml if I don't know the patient. Otherwise 2 ml each nostril, 3 ml each nostril. There were studies wherein 5 ml was done in Uttama Bala, but if higher quantity practice, 3 ml is the normal thing that we now practice each nostril, and we use a dropper for that. Now, next point. So that was about Bindu Pramanam. So Bindu Pramanam for Thaila Nasyam generally has been standard, which is the common mode that we all use, has been standard to used to be 0.5 ml, which probably every one of us must practice. There is no doubt about it. So for a better efficacy. One more thing that we need to understand is frequency of instillation. I don't know how many of us might have thought about this particular thing. Abeshajakshaya devam dvistirva nasyam ajaret ashtang hridayam. So abeshajak, till the medicine that we put in comes out, the second or third instillation of nasyam has to be done. Like in Vasti context, Ashtang Hridaya speaks about Dvitiyerva, Tritiyeva, Chaturterva, Asamyak Niruha Lakshanam. Till Niruha Lakshanam, second Putaka or third Putaka. Sushruta speaks even up to 5 Putakas. So the reference from Charaka which says Virechayet Tridivet Trihi Dvihi Atha Ekashova Balam Samikshya Trividam Malanam. According to the Bala, therein Chakrapani comments, Dvi eta ekasham iti tad dina eva doshanam utklishhtaiva bala traividyam apekshya yatha yogyataya yojyam. So the same day, same sitting, second or third instillation has to be given if the medicine that we are giving is not coming out or kabha chedanam is not happening as we expect. So that is very important. So this point was taken into consideration, and there was a study in 2012-15 done in Kottakkal Ayurveda College, wherein second and third instillation was done to a group according to their bala and one installation was done in another group. In the group that was done with second or third installation assay, it was Carpasias Thylam used for cervical spondylosis. They had given results within 3 days probably, and this, but the results over here after 7 days was much different. Okay, so the installation or the time of installation is also very important. That is virechayed tridi ata ekasho, as told by Charaka, or abeshajakshayadevam dvitirva nasyamacharet. So as we told, so Marshanasya, when Vagbhata says about 10 bindu, 8 bindu and Shat bindu, and Susruta, it is again a thing of controversy, rather discussion. Susruta speaks about Shukti Pramana, Pani Shukti Pramana. Shukti is nothing other than 64 bindu and 32 bindu as Pani Shukti, as told by Delhana in the commentary. So when all other Acharya speaks about 10 bindu, 2 bindu, 8 bindu, 6 bindu, Susruta speaks about 64 bindus as Shukti Pramana. The reason for that probably would be all others speak about first installation, second installation, third installation. Susruta doesn't speak about first, second or third. So probably Susruta might have told about the total quantity that has to be taken together. So in each bindu, each installation 20 bindu probably. That means a maximum for Uttama Matra 10 bindu, 5 ml each nostril was the intended amount. When we are considering second or third installation, this much amount is coming. So there is no controversy between, many a times discussion happens, controversy. Susruta says so much amount, Charaka and Vagbhata says this much amount. So there's a difference of opinion. No, I think there is no difference of opinion. They have put the same thing in a different way. Charaka and Vagbhata very specifically speaks about the number of installations to a to second or third installation too. Now, when he speaks about how long we have to do Nasya, see, Charaka says up to 7 days, Susruta says about 7 to 21 days, Sangraha says 5, 7, 9 days, Ashtangrade up to 7 days. So, and Sangraha very specifically says it is not mandatory that every day you have to do. If you are doing Marsha Nasya, alternate days you are supposed to do, so that you understand the Samprapti Vighadana in a very specific format. So, so that is very important. So when we are doing this particular procedure, Nasya, how many days basically depends upon the Samprapti of the Rogi. He has given us, see, when Susruta says 7 to 21 days, that means he has given us freedom. Like you start doing it, okay, minimum probably up to 5 days. You can continue up to 21 days. If you understand the Samprapti of the Rogi to be in Shiras or something related with Urtva Jatru, you can do, and this is the option. So there is no rules and regulation that these many days till Lakshanas. So age group 7 to 80 years, he tells us. So any condition within 7 to 80 years, we can do that. Now, one more important thing, clinical thing is the Sneha Paka for Nasyam. Mrudur Nasye, Kharo Abhyenge. So that is Pano Nastautu, Pano Vastautu Chikkane. So when he says Pano Vastautu Chikkane, Mrudur Nasye, Nasya has been told with Mrudu Paka by Charaka Vagbhata, but Sharangadhara has told Madhyama Paka and Susruta for all. And there was a study, a double-blinded study that was done in 2012-15, Department of Panchakarma at Kottakkal Ayurveda College in Kerala. Double-blinded study spoke about, it was actually a double-blinded study with different pakas. One was given, there were 3 groups, one were given different pakas, and the quality of Nasyam outcome was assessed technically, and there was no difference in clinical outcome. So many a times what happens is we do not have Nasya paka, so we don't use it. So now, in our practice, if Dhanvantara Thailam Nasyam I'm intending, if there is no Mrudupaka to Dhanvantara Thailam also, the Thailam that we use for external application, I go it for Nasyam. We should not restrict our practice. So we have to improve it. So like we have only Kshirabala 101, Dhanvantara 101 and as bottled kashayas. Bottled small one thing as our teas, no? So all other are available in Kharapaka. So we are using it in Kharapaka also now for Nasya. So we need not restrict, the study proves is so. Now towards the last part of the presentation, wherein, some things about how to do the procedure becomes very important. Because Acharya gives us very specific instruction of how to do that procedure. When we are not following it, I've seen a quality, difference in the efficacy of every procedure. Now the position of how we make the patient sleep during Nasya. स्निग्धस्मिन्नुत्तमाङ्गस्य प्राकृत आवश्यकस्य च निवादशयनस्तस्य जत्रूर्ध्वं स्वेदेत् पुनः अथ उत्थान ऋजुदेहस्य पाणिपादे प्रसारिते किंचित उन्नति पादस्य किंचित मूर्धनि नामते. So उन्नति पाद मूर्धनि नामिता वाग्भट अष्टांगहृदयं सूत्रस्थानम्. उत्थानस्य शयनस्य शयने स्वाश्रये सुखं प्रलम्भ शिरसा किंचित किंचित पादोन्नत. So this pralamba shirasatvam of the patient and unnati pada is very relevant, because how we are doing the procedure also adds on to the efficacy. So once this position, you know, if with this the head has to be tilted to a great extent by keeping some pillow in the shoulder, and pada has to be unnati. Many a times pada is not kept in a unnati state, and you know, I have practically observed when you are doing higher dose nasyas, when pada is not kept in a unnati state, there is a difference in the outcome presented by each patient. Now, time of administration, Pratah Shleshmani Madhyane Pitte Sayam Nishoshale, as I have already told you, and Charaka speaks out Prak Surya Madhya Surveva, Prakrita Avashaka Sacha. Either Prak Surya or Madhya Surya, when the patient has done his all his normal ablutions. And you know, many a times what happens is, generally when we are doing any kind of nasya, we ask the patient whether they have already had their morning motion, everything and all. We ask them basically, if they are not intending for it, I mean, if they have not gone it, we have to take care, because without Koshta Shodhana, doing Nasya again may lead to some other kind of problems. Okay. So if the patient is not, when we are planning a Nasim in the early morning and we ask them, no, I have not, my emotion is not clear, it's important that we give some Anulomana Dravya like Gandharvastadi, Chiruladi or Avipati Churna, so that there is Koshta Shodhana before Nasya, only then Nasya's efficacy will be much better. Now, you know, he very specifically speaks about the faulty positions. Okay. Anavak Shirasi Nasyam na Shirase Pratibhadyate. Atyavak Shirasi Nasyam Astulingya Vatishtati. So it's very important that we maintain the posture of the patient, because I have seen very specifically observed that whenever the posture of the Nasya is not properly maintained, things will be worked out. I mean, things don't respond the way actually we intend. One more important thing is, once, you know, before Svenasya, we do Svedana by tying the thing in the neck, I mean, eyes, and then we do Svedana. Immediately after Nasya, Kritecha Svedayed Bhuyaha, Akarshecha Punaha Punaha, Charaka says. Even after Nasya, Sangraha also says, when he says we have to do Svedanam, even after that, proper evacuation happens. Akarshecha punaha punaha. Tam sneham shleshmana sakam tata sneha na tishtati. So how much sneha we have already given in the to the patient. It is very important that that sneha comes out along with the shleshmana. And for that to happen, even after Nasya, we have to go for Svedana. So even after Nasya, Svedana we have to do practically. So, you know, in our practice, when we plan for a Marsha we make the patient undergo the procedure, as you all know, Nasya for oil for Abhyangam, oil before any procedure we keep up Talam, then cotton pad, gauze or lotus petal. We commonly use a cotton pad for protecting the eyes, and Svedana is done by normal water by using Nadi Sveda, we're using a cooker. Probably everyone will be knowing that. My only point is, if we are not going for talam properly, that may have its own effect in the response of the patient. If we are not doing proper Svedana, see, when he says Nivata Shayanastasya Prakrita Avashakasya cha Jatrurdvam Svedayet Punaha Snigdasvinna Uttamangasya. So Snigdasvinna Uttamangasya, the Uttamanga has to be done Sneha Svedana, and then he is made to sleep, and then again Jatrurdvam Svedayet Punaha. So we do Nadi Sveda in the previous aspect, and then we do Svedana to once he slept, we again do Svedana once again, and then we do the make the patient sleep in the posture with head down and the legs lifted up, and then by keeping 3 or 4 pillows, and then we do the Nasyam. Okay. So talam is applied and Abhyangam is done over the Shiras, Lalata, Kapala and all. Nadi Sveda is commonly done. Even Purva Karma, Ashtanga Sangraha speaks about Dhumapana, not only as Paschat Karma. Whenever we need a Sroto Shodhana in a patient, if there is Kabas, Kannatam of Kaba is seen, After Nadi Sveda, Ashtanga Sangraha gives us a freedom of doing Dhumapana even before Nasya. So the patient is made to sleep in the lying position. So that the way we do all know probably Hastena Dakshinena ta Kuryat Ubhaya Samam Pranadya Pichuna Vapi. Now what is important is Pranadya Pichuna Vapi, that is Avichinna Dharavat. So when he speaks about Avichinna Dharavat, that means continuous flow of medicine is important rather than giving in drop by drops. So there was again a study wherein drop by drop Nasyam and continuous flow Nasyam was compared. And the outcome was much better in continuous Nasyam. So this Avachinna Dharavat is very important. So Pradhana Karma, when we do it, when we make the patient to inhale the medicine and come out immediately after installation of medicine, massage over Pani Pada Griva Skanda has to be done and we ask for the patient. Sharangadhara speaks about something called as Nasya Dharana Kala also. When we are putting Nasya in the nose, he speaks about Dharana. He's asking us to wait for a period and then do inhalation or uchinget. So that probably he speaks about with respect to Vata, Paita, Pitta and Kabha, 10 matras, and this many matras, 20 or 30 matras. Okay, so that means that was also a method of making the medicine available to a higher extent. So when I am putting medicine, Sharangadhara gives the, so when from Brihatrai to Sharangadhara Samhita, he has modified the method to a greater extent. So Dharana Kala was told by Sharangadhara Samhita to have the medicine and wait for a longer period. So that was also important, which probably again I have practiced. I mean, I have seen when in some cases wherein patient is given Nasya and then he is made to do Dharana for a particular certain period and then he is made to inhale. In some cases of Parkinson's, in those cases I had the outcome or the what do you call it as outcome, in the sense the amount of phlegm or mucus that comes out after Nasyam, that was much higher. So that was Nasya Dharana Kala mentioned by Sharangadhara. So Pradhana Karma, inhale the medicine with moderate force and to spit it out through the mouth, turning head on the either side. Patient is made to lie in the same position for Matra Kala, 100 Matra Kala as told by Charaka. Now, in Paschat Karma, as I told you, immediately after Nasya, in my practice, probably once I started inculcating this Vedana after Nasyam, the output I have seen in Pakshagatam, chronic Pakshagatam cases wherein I've done, tried with Nam and I've done Nasyam with Dhanvantara Thailam. Soon after, when I do again make the patient undergo Svedanam, then things coming out was much higher. So I feel once we are doing it, especially in chronic Vataroga, when we see there is higher higher faculty affected, like movement of upper limb, pain in the neck and all, and the upper limb movement is still restricted. When Pakshagatam patients come, the lower limbs get response much higher than the upper limb. We all know that. So in those cases, we do Nasyam in the second stage. I mean, when they come for a next repeat treatment after 6 or 8 months. So in those cases, soon after Nasyam, whenever, so Svedana was done, the patient was having too much of flame coming out and she was feeding much Lagutam, and this kind of movements was much improved. So after Nasyam, Svedanam has to be taken care, and as a regular procedure, Dhumapana and Kavala has to be done and Talam has to be wiped out. Now, as I told you, the importance of second and third installation, is very important. And second, or I have done it in 3 or 4 cases wherein Bala of the Rogi is higher and the dosha is also higher. Second or third installation, when it was done, the patient's issues were much better basically. Whether it was Parkinson's cases, neck movement, whether it was Pakshagatam cases, high eye movements. When I'm speaking, because it is these common cases that I do Nasya, the patient was much better, but only in Bala cases, because I've done it in a young patient, considering him to be young, but after second Nasyam, he had severe headache, his BP got shoot up and all. So that patient was basically not, that patient was not basically intended for a second Nasyam. I thought he is Balavan, but Sattva was not okay, and it got all broke up that case. So points to note was Abhyanga Sveda depends on dosha avastha and purpose of Nasya. So if Kaba is much higher, the Sveda can be done for a longer period. And there are practices, not just Abhyanga, neck pain cases and all when we do Sveda. There is practice in Kerala, we practice some kind of portal Svedam in the neck. For example, Sankara Svedam with Kulattam and Dhanyamlam in the neck area, local area, when the patient does not have too much of money. So when we do just local procedure, not general body procedure, so neck we do local Sankara Svedam, then go for Nadi Svedam, then make them undergo Svedana. Nasyam. So Abhyanga Sveda depends upon the dosha avastha and purpose of Nasyam. That is important. In Pravarta Drava dosha, without or with minimum Sveda, but in Apravarta or Sandra dosha, Ushma Sveda has to be done for a longer period. If that is one more thing. Tikshna Dravya when we use, for example, in Swarasanasya we had seen that study with Ardhaga Swarasam and all, Snigdha Swinna Uttamangasya they're telling, no? So before putting it, directly put Tulasi Swarasa, patient will be having too much of burning sensation and all. So Snigdha Swinna Uttamangasya means we do Snehana with the Thailam for Abhyanga, Dhanvantra or Shirabala, anything, that we apply it in the nose also, inside the nose, nasal mucosa also, before putting in any Tikshna Dravya. So before putting in any Tikshna Dravya to the nose, it's important that we apply oil in the nose also. So precautions to do the position of the Nasya, it's very important. The patient should not sneeze, laugh, smile, etc. Spitting should be done properly. And there were some cases wherein I have seen people don't know to spit out actually, and they they can't spit and they just gulp it out actually. In those cases, Agrimandya comes up. Over a period. So we have to, some cases, we have to, before Nasya, we just have to inquire whether they'll be able to spit out and all, no issues, they'll be doing. And it's very important that avoiding exposure to dust, sun, breeze, alcohol, sneha dravya, the all contraindications, and as told in Sneha Panushnodavabajari, Syad Brahmajari, Shapa, Sheha, etc. Now, the most important part of any Nasya Karma. So during procedure, as I've told, how we are doing the procedure is important, how much we are doing, when we are doing. So to observe the Samyak Lakshanas are the most important. Samyak Snigdha Sukhoshwasa Swapna Bodhaksha Patavaha. When we are Brahmana Nasya doing Brahmana Nasya, so this Sukhochwasa Swapna Bodhaksha Padava. So Aksha Padavatum patients say actually. Now, doctor, I'm having clarity of vision. I used to wonder how am I going to assess it in patients, but patients say, I practice, I know, I do this Nasyam whenever I get time with this method. So I feel, my vision becomes more clear, my all what is Aksha Padavam, it has to be experienced, it cannot be detailed specifically. So Sukhochwasa Swapna Bodhaksha Padavam. So in Virechana Nasyam, Uro Shiro Laghavam, Indriyatva Shamam, Sroto Vishuddhi. So in all this Virechana Nasyam generally is Uro Laghavatam and Shiro Laghavatam. So patients say, I have some heaviness remaining, means our show the Nasya is not proper. If no, I'm feeling so much of good and the chest, everything is very light, they say, that means it is much better. Okay. So that is, many a times patients, I do Nasyam for frozen shoulder cases. I do Nasyam for shoulder, this Apabahukam cases. So they used to ask me, how medicine putting in the nose, my hands will be moving. Tell me, doctor, they used to ask us actually. So, but after Nasyam, they feel relaxation of this area also, not only head. They come to tell, yeah, doctor, I'm feeling so much of free in my shoulder area and the chest area. How is it happening when something we are putting in the nose? It has to be having its effect here, no? But this is experience. There is no doubt about it. So Brahmana Nasya, Ati Kandu, Gurutvam and all usually. So in Nasya complications, practically, what is that? Gadodreke, Kshamata, Ati Virechane. In a few cases, headache increased, that thing we have done, we have seen, and some kind of Kshamata in few cases that I have seen. Okay, practically. So practical complications, as we are told, headache, burning sensation, redness of eye, few cases, one or two cases, fever and cold, especially when we are doing it in sinusitis, Amavastha. We do it, I did it with Anutailam and all. Within 2 days, he had a fever. So some maculopapular eruptions in few cases. So how we manage is severe burning sensation, Nasya with sugar dissolved in cold water, And when there is too much of this thing, burning sensation, Shirabala, nasal bleeding, and repeated sneezing if the patient presents after Nasyam. Because if the Ghana Kabhatvam becomes Vilayana because of our Svedana, the patient presents with continuous sneezing. If I am doing Nasya for Kshavatu. In cases of Kshavatu, what's my clinical experiences? Patient goes for Nasya, OPD level, and he says, doctor, my sneezing has increased to such an extent. But he says 3-4 days I sneeze continuously, but after that, once everything is gone out, I am now comfortable. I have this lightness, everything, and also how body responds. To be very frank enough, I was always never able to exactly predict. Patients come and teach us. I did Nasya, this has happened. So I think, oh, is this is also a method that the body responds. So I think always the best way that we define Panchakarma, as I always say, it is stimulating the physiology to correct the pathology by itself. So body has got its own intelligence and the pathology gets corrected by itself. Now, I don't think I'll be going much into the mode of action, because mode of action, Shringataka Marma, we speak the only area where Shringataka Marma is mentioned with respect to Nasya Karma. And, we have so many theories pondered with respect to thing like nasal cavity, olfactory epithelium, respiratory epithelium, only site of CNS which interacts with directly the olfactory epithelium. So the possibilities of mechanisms of transnasal drug delivery is possibilities, nerve cell, vascular, lymphatic. I think I'll just skip this area because possibilities, because we have actually for a study we had approached many people to understand what exactly is happening in this thing with respect to modern physiology. So the best answer that I got from a senior physician of Trivandrum Medical College was, he told me, you have to understand one thing: your science acts at a nano level and the modern techniques are at micro level. So you are trying to assess a nano level thing by using micro level technology. Probably it may not match, and you can, if we are unable to analyze your procedure by using this technology, doesn't mean that, yeah, I do also believe if we are unable to analyze our procedures with respect to the technology that is available, it is not that there is a problem with our procedure, rather the technology is not enough to assess us, basically, I mean the way the procedure is. So I don't want to spend much time on this area, but of course this is also an area which we need to discuss as academician, but since time is running out, okay. So there are a few studies of nasal administration of medicines like luteinizing hormone, calcitonin and all nasal administration, and the blood concentration was seen which was much higher. So nasal route of administration is definitely a mode to have a systemic circulation, systemic difference or change that has been studied in various this thing, and definitely nasal mode of administration is one of mode of administration. So the hypoglycemic effect of insulin and hyperglycemic effect of glucagon through the nasal route was confirmed. So cryptorchid boys with undescended testes were treated with intranasal DPRH. So nasal method of nasal route was of course manipulated as a method to bring in systemic changes actually. So definitely there is no doubt that nasal route has got a change in system. As far as we Ayurveda people is concerned, I think as practitioners or academicians, we have to ponder or discuss or try to observe, analyze minutely the aspects that has been told in our Shastra itself, how Samprapti is working, how the Samprapti with respect to that patient is changing and all. Okay. So towards the end, before I share a few clinical experiences, as far as the procedure is concerned, fractional staging of Nasya procedure is very important. How we are doing it, how we are by the, keeping the higher position of the leg and the head, analysis of pharmacological action pertaining to each stage, and interpretation by forming hypothesis. Because pre-Nasya fermentation, vasodilator nerve spread on the superior surface of face, and fermentation increased the blood flow to the brain. Chatterjee says 22% dilatation of cerebral capillaries leads to 150% rise in blood flow. So the pre-procedure or Purva Karma has got its own relevance in the physiological status. The retention of medication helps in drug absorption. So drug absorption increased by massage and local fermentation. So when we are doing Abhyangam and the Svedana, it improves or helps in the retention of the medicine to a higher period. That is also important. And the post-Nasia massage of frontal, temporal, maxillary, mastoid and cervical regions helps to actually support or decrease the somatic irritation that is caused by the procedure as such. These were all few studies or tried to understand it in a modern physiological parameters and outcome of those discussions. So buffering effect on the altered cerebral arterial pressure due to the procedure, due to stimulation of baroreceptors and all, are subsided because of the post massage. So hence the conduct, posture and procedure are relevant. Okay. So I think we are moving to the last part, Nasyam in the clinical scenario. So I was trying to explain before moving on to the clinical scenario or the things, it as a Panchakarma person or as Panchakarma PG scholars, everything, how to execute the procedure in the correct format, in the right samprapti becomes the most important thing. And those all guidelines that has been laid down in our Shastra help us to understand, rather we have to be keeping on pondering, practicing it, reading it, practicing it, reading it to understand what is actually intended. So from Jwara, if we think of the clinical scenario, the last part, from Jwara to Vrana, in all the chapters, when we go through the Brihatrayis, you will find the mentioning of Nasyam in one or the other format. So I told you Nasya is that one Panchakarma which is used for both local as well as systemic diseases. You don't have Vamana for local thing, you don't have Virejana for a local thing and all, but Nasyam is not like that. It can be used for both local procedures as well as general. So from this spectrum of Nasyam ranges from Jwara and Vrana. So in practice, the most common conditions that we do, as I told you, I'm not getting into Shala Chem spectrum. Shala Chem, they do wonderful thing. I think one of our leading practitioners of Shala Chem, Dr. Srija Sugeshan, she has got hundreds of different clinical experiences doing Nasyam with Nimbasavam, Arishtam, Nimbatailam in different conditions and all. But I, or rather we commonly practice in cervical spondylitis, frozen shoulder, hemiplegia, facial palsy, Schizer, mental diseases, headaches, ENT conditions, which we don't do generally. Specific contraindication to any nasia is jwara, acute infections, pneumonia, and other conditions where patient is unable to inhale nasia oil. As I told you, 2 to 3 cases, we think the patient is indicated for the disease. Okay, the Vyadyavastha is Vyadyavastha is indicated for the disease, but the patient may not be yogya because of some reasons. The patient is unable to have inhaled the medicines. The patient is unable to spit out. All these things happens. There are people also, so we need to consider these two. In Vata Vyadhi spectrum, Dhanvantara Thailam, Kshirabala, Narayana Thailam are the commonly thing. Only in later stages. So Brahmana, Dhanvantaram, if it is Pittanubandha, Kshirabala, Vada Kapha, General, Sanipatika, Narayana Thailam. In cervical spondylosis, Mashadi Thailam, Karpasya Siddhi Thailam, Mashadi Kashaya Nasyam. Mashadi Kashaya Nasyam, as I told you, the study at Trivandrum, Sharanidhara Samhita speaks about a Mashadi Kashayam in Apabhavakam and Vata Vyadhi. That is also practiced. Karpasya Sthiti Thailam, which is more ruksha. Always cervical spondylosis in the background of Manya Stambha or Apabahukam we see with Vada Kabha dominance. So Mashadi Thailam, which is a little Ushna Brahmana. Karpasya Sthiti Thailam is also Ushna, not that Brahmana as Mashadi Thailam, but Ushna. So in those conditions, generally Ushna Dravyas are taken. But in Pakshagata chronic cases, Shita Dravyas are taken. In Schizer spectrum, when the Vega is happening, Vilvadi Gutika is done as Madhvana Nasya. I have seen and done it. Drona Pushpi Swarasam is also done. Tumba, we call it, is in Kerala. That's white flower. So that Swarasa is practiced by practitioner, which I have not done, but I have seen the case. In psychiatric spectrum, in all those Vilvadi Gutika, various Churna Nasyam, as I told you, to induce, to remove the Tamo Guna Adikya, different kind of, in psychiatric cases, I have discussed this with mental hospital, doctors who practice in government mental hospital in Kottakkal. So they use Pippali Churnam, they use Rasnadi Churnam, they use Vacha Churnam and all as inhalation. As I told you, we make up a small potli and ask them to inhale. In that way, so that is also a part of used in psychiatric spectrum. Brahmyadi Varti is pounded to powder and then they are asked to inhale basically. And there is a study also done, psoriasis, recurrent psoriasis, wherein assay is done with Tuvaraka Thailam. Tuvaraka Thailam is actually a thailam that actually induces Urdhva Adashodhana. It is told in Rasayana Padam, but it has been indicated for Chatur Prayoga. So Nasyam was also tried, but only one drop. It was not ML and all, it's a Tikshna Nasya. And you know, those cases who have repeated attacks of psoriasis and those conditions wherein, you know, Jatru, the scalp is affected to the maximum. In those cases, we have done that. In 2 or 3 cases, we have done. It was a study also. So the patient has got severe irritation because of Tuvaraka Thaila. That is done after Vamana and Virechana only. But you know, recurrence was much less. He did not have any symptoms at least for 1.5 years further. And then again, once he started apathy, it again reappeared. And for the Nasaga Raktapittam, Kalka of Draksha, Kalka of Chandana in Shita Jala. That I have done. When we have just you use Shita Jala, apply little Chandana. It is something commonly available with us in the hospitals and all. We do that. And as I told you, Shatadauta Gritam, we have done it. Shatadauta Gritam, we just apply it. We do Shatadauta Grita Pichu over the nose, and Grita is put in the nose as Nasyam. And Amrasti Swarasanasam, that was communicated by a traditional practitioner who used to do this when cases used to come to him. Now the ENT spectrum, as I told, with the different conditions, they do it Kunkumadi Thailam, Surasadi Nasyam, Tulasi Swarasa Saindava Madhu. As I told you, that was a study at in sinusitis at Government Ayurveda College, Trivandrum, as well as Ardhaga Swarasa, Madhu and Saindavam. Hingu was also done for a study in sinusitis. Bringaraja Churnam with the milk actually is given for premature graying conditions for a longer period. Bringaraja Asavam was also tried for a few cases. They do that 1 drop each nostril. They ask for premature graying. So Bringaraja Swarasa, Bringaraja Churna with Kshira, Bringaraja Asava. In ENT spectrum, especially premature graying. And for different kind of sinusitis, Rakta Nasyam, this was again tried in Trivandrum Ayurveda College, fungal sinusitis, wherein the patient's blood they take out by using 5 ml syringe and they do Nasya with that in a serious fungal sinusitis. So I've Dr. Kannadas, who was actually their professor, and he used to practice this. Rakta Nasyam in fungal sinusitis, and other than that, Vidangam, Trikatu, Jyotishmati Churnam, in the spectrum of sinusitis, they do that. Gynec spectrum, one of the common thing with respect to Nasyam is Kshiravalla Thaila Nasyam done in menorrhagia. So when they do Kshiravalla Thailam, immediately the menorrhagia, the dysfunctional uterine bleeding cases and all, it comes down. So definitely Nasyam has got an action in HPO axis. That's the common thing that we speak. Clinical cautions that from practice is and avoid Avarti Thaila for continuous use, because if we use continuously Avarti Thaila, some kind of issues over a period, Agni Mande, etc. we have seen. So whenever we are doing Avarti Thaila, we use 2 to 3 days or 4 days, then ask them to put a gap and do Anu Thaila for 1 or 2 days, and then restart Avarti Thaila. Swarasa and Churna to be used immediately after their preparation. If we keep for, I had a case wherein we had kept this Tulasi Swarasa Nasya for a longer period and done Nasya. After 1 or 2 hours, they developed all kind of itching and rashes over the face. So this Swarasa has to be done immediately after Nasyam. It should not be kept also. And proper purification of the drug is essential. And a few clinical experience before I end, I would like to share, because Nasyam always makes me to think of 2 specific cases. One was a case of Mrs. Faiza. She was actually admitted to the college where I was working earlier, Parshnikadava Ayurveda College. She was having recurrent seizures, a recurrent attack of strokes, and she within 3 months, she was a known case of diabetic, hypertension, regular medication. Some because of some stress and all, she had first attack of stroke. She had right side weakness, and then within 15 days she was admitted, had been on antiplatelets and all. She was discharged within 15 days, second stroke. Within next 1 month, third stroke, and she went into coma. And they had told there is no other option, and she got into our college. So I was there in our department. I had admitted the case, and I still remember I had discussed this case with Ravi Shankar Parvaji sir. So sir told you had this Tamo Gunadike, comma was there, Glasgow comma scale 3 was the thing. So after discussing with him, so we actually tried, then he suggested Sapnyanasha Ganam of Charaka Shadvirechna Shuddhashatiyam. So in there, Sapnyanasha Ganam we had taken, we had made the available powder, and we had started Churna Nasim to her. So, you know, we had started Churanasim with 1 muchiti, as I told, with straw we used to do that. First, I started with each day, 3 or 4 days continuous. She started opening her eyes. Next day, we continued it 2 times. Almost for 14 days, we continued it. So she started opening her eyes. She started responding to sounds. Some musics were kept. She started responding. After 10 days, this tears started coming from his eyes. Actually, that itself was much better for the husband and the family who were with her. And one observation that I found was her legs, lower limbs and all were like, it was like some kabobal lebatum probably when I go and touch and all, some kind of, we could not see any kind of veins or something. Once we started doing this nasya, 10 days and all, her all veins of the, she was a fair skinned lady, the veins and all in the lower limbs especially, it got conspicuous. We could see the green veins and all, and the swelling that was in the body was reduced. We were doing nothing other than doing nasya. But of course, just before nasya, as this thing we used to do amalaki khwada kashaya dhara, just for that, and then we used to do nasya. That was done as a preventive because this is it was an infarct case. So since this was actually what you call it as Ushna Dravya, to prevent this Amalaki, we had done that. And the second case is one of Mrs. Shanta. This actually case was a case that had a history of traumatic history. She had fallen from her terrace. She was having severe head injury with so much of contusions and all. She was done craniotomy and she was under coma for almost, I think, 7 or 8 months. She was in a physiotherapy and somebody had recommended and she had been to her hospital. So we again tried the same thing after discussion to Shanta also. And you know, it was a tragic thing. I mean, I can't understand whether it was this or not, but I'm sharing it with you. 4 or 5 days we had done. Every day when we are doing it, it was again done with Sapna Sthapanagana. She started opening her eyes and her husband and son was with her. They were very happy. On the third day, she started opening her eyes. She had opened her mouth. She had to, for the first time, she was having food. They had given some idiyappam and all in the morning and everything was okay. So that day evening, on the fourth day evening, I had gone and I was doing Nasim to her. She had done and I wait usually for 1 hour in the hospital after Nasim to observe any issues. So after that Nasim, it's just, we just do stroke and we just blow it, okay. So, and that day she was fine. I mean, after she opened her eyes after Nasim and she looked at her husband and son and some kind of tears were happening fourth day. So I was also happy. I mean, I waited and she was okay, fine. And on the fifth day morning, suddenly by 8 o'clock, she was opening eyes. Everyone was happy. She wanted to get up some signs she was showing it seems. So she got up and she was made to sit in a chair and the son wanted to have food. So son gave some food to her. And suddenly she had a choking. I don't know whether it was aspiration or something, but suddenly she had a choking like thing and then she lost her life. And suddenly when there was loss of consciousness and the pulse, everything got off and she lost her life. So immediately I had a call and we had been there. So Nasim was done on the previous day, 4 o'clock, 5 o'clock. I was there up to 6 o'clock. This happened by morning 8:30 and all. So I had discussed with Parvajay sir also after that. So probably what was my understanding, the first case was an infarct case with Kabapitta. This was a Abhigataja case with a more Pitta. Nasyam is the cause, we may not be saying. It is not probably. But the patient responded well. But in hemorrhagic cases or whenever there is Pitta Dushti in the background, Churna Nasya, I think hemorrhagic cases or any kind of traumatic cases, Churna Nasya, we have to be taking care. I think from the clinics, Nasyam as a procedure is most ideal in case of stroke in the initial stage. If 7 to 8, I've done cases wherein with the 10 days history, they come to us and we do Nasyam and the patient improves to a great extent. But Nasyam is always a procedure that increases the blood pressure of the patient. So whenever there is blood, immediately after Nasyam, blood BP usually shoots up to. If there is no control of blood pressure of the patient, it's important that it has to be controlled. Okay. And in hemorrhagic cases, in wherein Pitta Rakta Dushti in the background, we have to be thinking twice or thrice before we think of any kind of Nasya. Especially like Sapnya Sthabana and all, we will not be able to do that. But in chronic cases, Brahmana Nasim like Dhanvantaram, Shiravala and all is much higher. And I am doing and I'm trying Nasyam in idiopathic Parkinson's disease, Brahmi Gratam, Shirabadara Thailam, Special Kalyanaka Keram, Sahajaradi Thailam 7 Avarti. But how much it will affect, how long and all, proper document, opinion or thing, I'm still to come out. But with all these things, patients improved with their own like sleep, quality of sleep, their way of walking and all improve. In the same way, in some cases wherein I have tried Nasyam and Parkinson's, they respond negatively also. That the improvement they had with our Vasti and Ruksha treatment, Takradara and all, it goes off when we start Nasyam. Both these things have happened. So still I'm yet to analyze the Samprapti of neurodegenerative diseases and at what stage we can apply Nasya. But there is no doubt that Nasya has got a very high role in neurodegenerative diseases as preventive, curative, and rehabilitative. So that exact decision making, I think it needs more clinical experiences. So before we end, if no spitting of medicine is done after the procedure, like when we do Nasya practically, many a times people may not spit out any medicine. Okay, they just do little kapha and all. We have to be careful because then that medicine is had gone into their koshtam. So there will be possibility of Agni Mandhyam. So status of Agni and Koshta has to be monitored even when we are doing any of the Nasya to the patient. So I think in the conclusion, what I have to say is, I've talked about three parts: the basic Samprapti analysis, which has to be done with very specific Swatantra Vyadhi or Paratantra Vyadhi, and where actually Nasyam has to be placed. That is very important. And which Nasyam has to be placed. As we told, where Shiro Virechana Nasyam has to be done, where Shamana Nasyam has to be done, where Brahmana Nasyam has to be done. So we have to decide which Nasyam. And once which kind of Nasyam, which could be the medicine that we can apply. If we don't have any specific the Dravya, Tila Tailam, Go Gritam, that itself is enough for us to do Nasyam. There is no specific, because it will have its own effect. Once we decide upon which Nasyam, with what to do, the conduct of the procedure, the dosage of the drug in with respect to Bindu Pramana, the second or third installation as this Tirva Nasyam Acharet, post Sweda and time of administration is very important. And towards the end, how long to do or how to assess, assessment of Lakshana, not only Samyak Lakshana, Hina Lakshana, etc. Other than that, the general physiology of the patient with respect to the nature of Koshta, with respect to the Agni status is also very important. So I think with this, I conclude. So we need to critically review, like as practitioners, that how best are we practicing all these things and doing the best for the patients. So in short, as I told you, Ganonata Prasannatok Skandagrivaस्य Vakshasa Dridendriyastapalita Bhaveyu Nasya Shilinaha. So as told, the effect of Nasyam, the Ghanonnata Prasannatok Skandagrivasya Vakshasaha Drida Indriyaha Apalitaha. So if to prevent Palita, to have Drida Indriyatva, etc., Bhaveyuhu Nasya Shilinaha. Nasya Shila will have all these things. So at least let us practice Nasya and in our clinical things, also in our own daily routine, so that we get benefited by it. So I think in respect of Nasyam, we have lots and lots to do, more miles and miles to go. So thank you.
Thank you, ma'am. It was very knowledgeable session. There are some questions, ma'am. Shall we discuss?
Yeah, sure.
First question by Rohit. Pratimarshanasya in 1 month baby is safe, and with which oil we should do?
Pratimarshanasya in 1 month baby. Yeah.
Yes.
I don't think 1 month baby is indicated for Pratimarshanasya. Ajanma Maranam only Vasti.
Thank you, ma'am. Next question. If we want to follow Pratimarshanasya as Dinacharya, either we have to choose one kala from 14 types or all the 14 kala to be done.
I think, as I told you, those Pratimarsha Kala, Pratimarsha Nasya, when they are speaking about the 14 Kalas, Those 14 kalas indicates the situations wherein our body is stressed, undergoing stress. So if you are doing too much of adva and you feel your body is under stress, pratimarsha nasya can be a choice at that time. So there is no rule that you can do at least 1, 2 or 3, at least twice. You know, recently in an interview with our Prime Minister Narendra Modi, I had heard him saying that he does Sarshapataila Nasya every day night, it seems. He is practicing for long years. He just apply it and he just does this inhalation. So at least morning and night we can do every day. Okay. And other kalas, it depends upon our way of stressfulness. So if we think the procedure that we have undergone has made some kind of stress on the body, we can do that. As I told you that Italian people were doing it in all times, after food, after lunch, after this thing, during sleep and all. But I don't think 14 times, all the 14 times, everyone will not be undergoing all the 14, no? Klama, Adva, Shrama and all. So whenever we are undergoing that, that can be used.
Thank you, ma'am. Next question. Please guide about the temperature of Nasya Dravya.
Temperature of Nasya Dravya has been standardized as Sukhoshna basically, and Sukhoshnatom is just below 99 degree Fahrenheit. So because you know nasal mucosa should not be irritated. So this is the thing that has been standardized. But we just use it in the hand. We just to be little warmer than hot. So it is below 90 Fahrenheit. And all we generally don't heat. It's for Thailand.
Hello, ma'am. Excuse me, ma'am.
Hello.
Thank you, ma'am. Next question.
I couldn't hear for a few seconds. Did you ask anything?
No, ma'am. Next question, ma'am. Can we do Nasya in menstrual cycle?
Can we do Nasya in?
During menstrual cycle?
Contraindicated. It is contraindicated. In Rutumati, Nasya should not be done.
Thank you, ma'am. Next question. Can Marshanasya, Shirodhara with Taila and Matra Basti be given together?
I think this we were discussed. See, whenever Vasti, Datta Vasti Hataswaraha, contraindicated for Nasyam. So Marsha Nasyam cannot be given. But at the same time, once somebody is practicing Matra Vasti, which can be done in all kalas, if the Agni of the patient is okay, Matra Vasti may be done with a gap of done. Vasti, when he is speaking, I don't practice it generally, but I was when we had definitely an case wherein a scenario wherein Shirodhara was done, Nasyam was done, and then Vasti was given. Matra Vasti, if we do it, probably it is not contraindicated according to Shastra, but Datta Basti, it has been told a contraindication to Nasya. So generally, it should not be done. Because I have seen complications wherein Vasti and Nasim were together done. Because, you know, when Vasti was done at the same, and, you know, there were practitioners who do Vasti in the morning and evening, they prefer Pratimarsha Nasyam. Okay, if it is Pratimarsha, what's the problem? In our hospital itself, there was, some consultant were doing, and I had discussed, and I told, let us see. I was contraindicating. So Vasti was done, that was some Madhutailika Vasti in the morning, and evening they were preferring Pratimarsha, not Marshanasya. I told Panchakarma department will not do anyway Marshanasya, and if you're too particular, we'll think of Pratimarsha. But even after that, you know, the patient developed Agni Mandya, the patient's issues increased and all. Because, you know, we are manipulating what, see, Nasya we are manipulating the Shirogada route, and in Vasti we are manipulating the Apanavayu. So when we are manipulating Pakvashya Sthana and Apanavayu, and we are creating a kind of physiological stress to the body needs time to recoup it. At the same time, we are creating some other kind of stress to the, again, what you call it as the Shiro Indriya to a Urdhva Jatru Gada thing. The response will not be as intended. What is our intention? Our intention is to have a much better response to the patient. So if that is the thing, I don't think it will be a problem issue. But you know, many the discussion which I was a part, people, I mean, there the faculty was speaking of, like, when the patient comes to you for only 7 days and you have to do Shironad, Shirodhara, Nasyam, Vasti, everything together. What is the role? I think, I mean, doing so many procedures is not important. What is intended in that body, in that samprapti, in the optimum way we need to give. So in that, it becomes again discretion of the physician. But at the same time, somebody thinks he has got Rukshata in his Koshta also. And he has got this thing, Rukshata, he needs Snigdhatvan towards Urdhva Jatru, I mean, Indriya Pushti also. So why can't we go for this thing? If you are very confident about the Vadakopa of the patient in all those levels, probably Matravasti and Pratimarshanasya may not be contraindicated, but otherwise it is generally contraindicated.
Thank you, ma'am. Now I request Dr. Supriya ma'am for vote of thanks.
Good afternoon to all. Namaste, ma'am.
Namaste.
Myself, Dr. Supriya Bhosle. I would like to thank our today's eminent guest speaker who enlighten us with the topic current practice of Nasya, a critical view. Really, it was very beneficial, ma'am. Somewhere in the minds of the students, it was there that Nasya is nothing much important than its classification. But I'm really very sure that today all the delegates, students especially, have got a different perspective in regard to Nasya procedure, ma'am. Thank you very much. As you have elaborated the procedure in three different perspectives, that is mode of application, dose standardization, practical clinical applications, the different clinical guidelines for selection of Nasya from such a wide spectrum of classification as per the different acharyas, stressing on the importance of matra of Nasya for better results and different yogas for clinical conditions. Thank you so much, ma'am. I wholeheartedly thank you on behalf of my department staff, our college staff, and Principal Sir Dr. K.C. Das Sir. Thank you so much, ma'am. I would like to extend my thanks to our committee members and chairman and our Principal Sir for his continuous support in conducting this webinar, Paanchjanya 2020. I thank my department staff, my colleagues, PG students, the participants and delegates from different places for patience listening and making this session very harmonious. Thank you one and all.
Thank you. Thank you, Dr. Badrinath, Dr. Divyajyoti Moharana, for the opportunity. And I'm also very thankful to all of you that I could share my own thoughts to all of you. So regards to the Department of Panchakarma at college.
Thank you, ma'am. Shall we end the session, ma'am?
Yeah, sure.